Second white coat. Subscribe and like. Let's learn medicine together.
All right, today we are tackling a really high-stakes diagnostic challenge. We're looking at 4 critical CNS conditions that can look scarily similar. What we're going to do is build a quick and powerful framework to tell them apart when, every single second counts.
Okay, let's just jump right in. Picture this. You're on call. A patient is going downhill fast. They're acutely confused. They're having seizures. What is it? Is it an infection, a tumor, something else entirely? Your mind is racing with possibilities, but what you do next is absolutely critical. This is where you need clarity, and you need it now.
So how do you get that clarity? Well, it turns out it comes from a really simple structured approach. Before you even think about a specific diagnosis, you just need to ask 3 key questions. I promise you, these questions will cut through all that noise and get you pointed in the right direction every time.
So let's build out that foundation. This is what we'll call the 3-question framework, and it's the main tool we're going to be using today.
Here they are. It's this simple. First, how fast is this happening? Are we talking hours, or has this been going on for weeks? That's your timeline. Second, is the patient immunocompromised? This is a huge fork in the road. And third, is this a diffuse process, or is it a mass lesion? Is the whole brain kind of angry and swollen, or is there one specific thing taking up space? So, timeline, immune status, lesion type. That's it. Let's see how it works.
All right, now we're going to take that framework and apply it to our 4 main suspects. I want you to think of these as 4 different patient files, and we're going to solve each one like a mini mystery using just our 3 questions.
First up, patient file number 1, HSV encephalitis. The words you need to lock in your mind for this one are acute and destructive. This is not a subtle disease. This thing is fast and it is violent. So what's the story here? You've got a patient who was perfectly fine yesterday, and today they've got a fever and they're confused. The timeline is super acute. We're talking hours to days. Then they start having seizures, maybe some specific weakness on one side. The real dead giveaway, though, is on the imaging. HSV just loves to attack the temporal lobes. It's a diffuse, inflammatory mess.
So here it is. This is your trigger thought, your mental shortcut. When you see an acute, sudden onset of altered mental status and seizures, your brain should immediately scream HSV encephalitis. That has to be number 1 on your list.
Okay, let's grab our next file and see how this works. Patient file number 2 is toxoplasmosis, and the key phrase here is completely different: multiple hits in an immunocompromised brain. Right away, you know we're dealing with a different kind of situation.
Let's use our framework. Is the patient immunocompromised? Yes, here they're HIV positive. How fast did this happen? It's subacute, so it's been developing over days to weeks, not hours. And what does it look like? Well, we're not seeing that diffuse inflammation. Instead, we see multiple ring-enhancing lesions. They're basically little abscesses. This feels much more like a space-occupying problem.
And this gives us our next perfect trigger thought. If your patient is HIV positive and you see multiple ring-enhancing lesions on that brain scan, your primary diagnosis is going to be toxoplasmosis.
Okay, on to our 3rd file, neurocysticercosis. The story for this one often boils down to one really dominant symptom. The phrase to remember is simple: seizures from cysts.
So what's the deal here? Well, the main feature, the reason the patient even came in, is seizures. The timeline is often way more chronic, or it comes and goes. And on imaging, you see the cause plain as day. You've got these little cysts just sitting in the brain. What's really cool is you can often see them in different stages. Some are active, some are dying, and some are just old, calcified scars.
So the trigger for this one is crystal clear. The main presentation is seizures, and the imaging shows cysts, especially with some calcifications thrown in. You've got your diagnosis. It's neurocysticercosis.
And that brings us to our final file, CNS lymphoma. Now, this is our other condition that pops up in immunocompromised patients, but it has a totally different signature. The key phrase here is one big lesion. So just like our Toxo patient, this person is HIV positive. The timeline also subacute. But here is the massive difference. On the scan, you're typically going to find a single, solid, enhancing mass. It looks like a tumor, because it is one. This is a huge contrast to the multiple lesions you see in toxoplasmosis. You might also get some other clues, like weight loss or night sweats.
And that gives us our last really powerful trigger thought. If your patient has HIV and a single brain mass, your leading diagnosis has got to be CNS lymphoma.
All right, we've met all 4 of our suspects. Now it's time to put them all side by side for a final showdown. This is going to lock the knowledge in place for good.
Look at this, it puts it all together so nicely. You can see the patterns. HSV is the only one that's truly acute. Toxo and lymphoma are both subacute. They both happen in HIV patients, but you separate them by multiple lesions versus a single mass. And neurocysticercosis kind of stands on its own with that chronic timeline and its presentation of seizures from cysts. This is the entire diagnostic cheat sheet on one slide.
So let's burn these rules into memory, rapid-fire style. Rule number 1. If it's acute, with confusion and seizures, you think HSV.
Rule number 2. Patient has HIV and multiple ring lesions on the scan, it's Toxo.
Rule number 3. If the whole story is about seizures and you see cysts in calcifications, that's neurocysticercosis.
And finally, rule number 4, patient has HIV and a single brain mass, it's CNS lymphoma.
And there it is, a simple framework and 4 high-yield rules that let you tell these really critical conditions apart. You've got the tools now, you've got the trigger thoughts. The only question left is, are you ready for the next case that comes through that